when you have a disc herniation, the symptoms might be not only back pain, but numbness or tingling into the legs. And it can be without back pain too. Okay, we've got Papa Smurf here. He lost a bet with his daughter. Had to dye his hair blue. So, he is Papa Smurf for today. So, Papa Smurf here suffers from, in the past, radiculopathy. That's a pinched nerve in the lower back. But he's lucky in the sense that he just gets numbness and tingling. And that's a sign that it's a bit of a newer injury, meaning that typically when you have a disc herniation, the symptoms might be not only back pain, but numbness or tingling into the legs. And it can be without back pain too. And those are the sensory nerves. And the sensory nerves are a little bit thicker than the nociceptors, which are the nerves that control pain down the leg. And that's much more uncomfortable. And most of you know it as sciatica. Instead of getting sciatica, he gets pins and needles and tingling into his left calf. He just had a flare-up recently and just drove a couple 100 miles. So, you know, when you're sitting that long, that compresses the disc and adds a lot of pressure to the disc. So we're going to go ahead and we just put him on traction for 20 minutes. A little bit over 20 minutes, and now we're going to do a little bit of cox flexion distraction technique. That's definitely the best technique for this kind of condition. Okay. I'm going to start up a little higher here. Let me know if you have any pain in the legs, pins and needles, which you probably won't. You shouldn't. You don't normally have that, right? Yeah. Should feel like a good stretch though. We just put him on a little bit over 20 minutes of decompression, spinal decompression, to take some pressure off that disc because he's been sitting for hours. How long did it take you to drive that?
About 5 hours in 2 different slots.
So 10 hours total in the car.
Yeah.
I don't know if you felt that release before. 2 seconds ago. To the QL muscle here. He responds really well when we release the trigger point and then go back and do cox flexion distraction technique again. Doing this is important. It really helps to loosen up the muscles that are binding the facet joints together and really preventing any motion. So this is going to really help open things up. And it's probably a little bit sore.
Yeah.
Like a good pain?
Yeah.
Yeah. Except when you're having sciatica. When you're having sciatica, it's not a good pain. Nothing is a good pain. Sciatica can be very uncomfortable. This is a milder version of that in the sense, again, that it's affecting the sensory nerve, not the nociceptor nerves. And deep breath in and all the way out. You were pretty bad last week.
Yeah, it was. It felt so much better coming out of here.
So he went to a surgeon, right?
Yep.
Spinal surgeon?
Yep.
And what were you told?
That, you know, surgery was a very good possibility for me and I should possibly get it. And then I came to you.
Yeah, then he came to me. Now, he saw me before about 3 years ago when he first injured his back. Remember, he couldn't ride his motorcycle. It hurt him so much every time he went over a bump. Remember that?
Yeah.
And he was in really acute pain. And, you know, in a couple of weeks, we got him out of pain, and he was fine. And then saw him a few times in 2018, and then once in 2019. And then I'm not sure why he went to the surgeon in the first place, but this is definitely not a surgical case. And I implore all of you, anyone watching this with back pain, disc herniations in the back, just because you have disc herniations in your back does not mean you're going to be in pain for the rest of your life. It's really important to understand that and know that there are options, and your doctor may not tell you about them. Your surgeon may not tell you about them. You need to do your own due diligence. And I will tell you this, Cox flexion distraction technique, hands down, is the gold standard when you're dealing with chronic pain and disc herniations, disc damage of any sort, even failed back surgery. But you don't want to be in that situation, right? I'm preventing him from ever even having surgery in the first place. He's got his whole life to do that if it ever gets to that point, okay? But once you have surgery, you can't reverse that. And most back surgeries fail after 5 years if you follow up with those same patients. The statistics are awful. So we do what we can here to prevent people from ever going under the knife, and even from ever having to have injections, which you did, right?
I did twice, yeah.
So he tried the injections twice.
And they didn't really do much for me.
Didn't do much, and there he is. He's back here again. So now you know, in the future this flares up, just come straight here. We'll address it. This time it only took 3 visits, I think, and I mean, you just did a 700-mile drive, so. But all right. So now what we're gonna do here is a little bit of Thompson technique. So we're gonna mix Cox flexion distraction technique with Thompson technique, and that's just where this table here is gonna pop up, and we're gonna just do a nice gentle adjustment there, realign his pelvis, and then we're gonna put him back in the Cox flexion distraction technique again here, and relax here. Because he's been sitting on his tailbone, I know that his lumbosacral joint is in hyperextension, also called facet syndrome. Anybody that sits for a long period of time, which is a huge part of the population, just sitting at your desk, or if you're a driver. So that's why I'm doing this adjustment here. Now, without bending your knee, raise one leg as high as you can. Good, and down. The other one. Good. One leg harder to raise than the other?
Yeah, this one was a little harder.
The left one, yeah. Cross your left ankle over your right ankle. And uncross them, and try that again.
Yeah.
Okay, how's that?
Feels good.
Cross that one over there again. Nope, left over right. Yeah. Uncross them now. Good. Okay. So he's got the 3 bottom discs in his lower back that are a little degenerative there. We have an x-ray but no MRIs on him. We're going to assume it's a herniation or a bulge. We don't necessarily need an MRI because he we resolved a lot of his complaints pretty quickly. If somebody continues to have leg pain or numbness in the leg, that's when we typically send a patient out for an MRI. Did your orthopedist get you an MRI before even considering surgery, or did he just...
Yeah, we did. I can get you a copy of that.
Great, yeah, I would love to see a copy of that. Remember how many discs were...
2.
2?
Yeah.
Okay.
2 with like a little bit on the third.
Yeah, and on the x-ray it looks like 3 of them are degenerative, so thin. So that makes sense. So here you'll notice my hand is not going below L3, because I know his L3, L4 disc is damaged, L4, L5, and L5S1. So we go L5, L4, L3. We don't want to put the hand lower than right here, because then we could flare it up and he won't get off the table. That would be good. So when you see a chiropractor that does this technique, they can have this table. It doesn't mean they're certified in the technique. You really need to know what you're doing rather than just buying the equipment. Sometimes that happens. Okay, now go ahead and raise one leg up as high as you can and down. The other one. How's that?
Oh, good. Much better.
Turn over on your back. Better be careful betting with your daughter. She may go for double or nothing and may make you shave it next time, like my head. You can never be assured it'll grow back either.
Truth.
Nah, you look like you got nothing to worry about. Slide down a little bit for me. There you go, perfect right there. Up just a smidge for me. Yep, good. Cross your arms. Take a deep breath in, tuck your chin down, half a sit up. Deep breath in, and blow all the way out. And one more deep breath in. Great. Slide back on your back. Any headaches at all?
No, I haven't, but
Stiffness in the neck?
certainly stiffness in the neck. Yeah.
So, relax your head, your shoulders. Wiggle your toes. Tender right there.
Yeah.
Take a deep breath in. We're just doing some trigger points here in the suboccipital region, which is right across the bottom of the occiput. If you get headaches and those are tender, that means your headaches are coming from your neck. They're tension-related headaches. And you can do some stretches for that. I actually did a video a while back on a bunch of stretches you can do for 5 minutes, even a minute, just to release those tension headaches. So again, if you get headaches on the bottom of your skull here, where the hairline is, across that ridge, if it's tender and sensitive, They are tension headaches, and it probably has a lot to do with you being on your cell phone a lot.
Yep.
Or on a bad setup on your computer if you're working in front of a computer all day. So those are two things to look at. And then the stretches video that I did for headache stretches. Relax yourself here, wiggle your toes. We're going to do something here called stair stepping. So this really helps to get the facet joints gliding better. Just small figure eights at every level. Do you feel like a bobblehead Smurf right now?
A little bit.
Lift your head up. Drop it back. This is traction for the neck, for the cervical spine. Very similar to the traction we did for his lower back, but that was spinal decompression. They're slightly different. Decompression is computerized, traction is just manual traction like this. Lift your head gently, drop it back. All right, you're all set.
All right, thanks, Doc.
You're welcome.
Oh.